Hello, and welcome to this year's ACR Preview podcast, brought to you by the Lupus Forum. My name is Ed Vitale. I'm chair of the Lupus Forum, and I work in the University of Leeds. And today I'm joined by Cindy Aranow, who's a professor of medicine and director of the Clinical Autoimmunity Centre of Excellence at the Feinstein Institutes for Medical Research in New York. Welcome, Cindy.
Thank you. I'm really thrilled to be here with you doing this again. So
It's always exciting at this time of year, isn't it?
it is.
So today, we're going to look at the presentations that we're looking forward to at ACR 2024. You can find a lot more detail on these in the highlights brochure. And as always at this conference, there's a really good range of abstracts covering a lot of different topics. So, Cindy, do you want to kick off with some of your highlights?
Sure. And there was so much to choose from. But
Yeah.
begin with, I'd like to start with a pair of great presentations looking at anifrolumab. So Malvina Binka will be presenting a real-world claims-based study reporting a reduction in disease flares and oral corticosteroid use in patients with SLE on anifrolumab. And Doria Andrea will report DORISH remission with anifrolumab in a post hoc analysis of the two TULIP trials. Importantly, on the topic of steroid reduction and early lupus, Dr. Nakay reports on the impact of hydroxychloroquine and belimumab on early glucocorticoid reduction in new onset SLE using a retrospective analysis. And continuing with this belimumab theme, Marta Mosca highlights the reduction in disease flares versus placebo using a large integrated analysis of adults with active lupus who were participating in the belimumab studies. So, belimumab and anifrolumab are agents that have been available for some time, some years. And I think we've gotten used to using them and feel comfortable using them, but it's still really, I think, vital to look more deeply into them and to look at their effects, not just on the disease activity instruments that got them their approvals, but to look at things like flares and to look at things like steroid reduction. And particularly, and this is a interest of mine, is what happens if you use things earlier? And the EULAR guidelines do suggest using biologics at an earlier point in time and not just wait until, we've cycled through several of the DMARDs. So I think that these are some really important abstracts that I'm really looking forward to learning more about.
Yeah, and actually, really good comment because I thought that too, which is you learn more about the existing biologics. It also gives you some ideas about what the positioning might be for the new biologics. And there are quite a few of those coming at this Congress. So there are some phase 3 data, not just for anifrolumab and belimumab, but there's some important news about a new positive phase 3 trial. Always a big thing in lupus. So Megan Klaus is going to present this on improvements in SLE disease activity with dapirolizumab pegol, which is a CD40 inhibitor. And it has a lot of different immunomodulatory effects. So it's quite different from the existing therapies. Another one I noticed that was interesting is going away from the industry trials. This is a trial from India, but actually 3 arms. So this is Alekia Amudalapalli, who's going to be presenting a phase 3 comparator trial of the safety and efficacy of cyclophosphamide, mycophenolate mofetil, and tacrolimus as induction therapies in lupus. So it's quite common to see trials of individual drugs for lupus, but it's not so common to see lots of them side by side, which is a useful piece of information. And then for some of the neurotherapeutics undergoing phase 2 trials, there's ianalumab. We've talked about a bit before, and this is a sort of combined B cell depletion and anti-BAFF in the same molecule. That's looking quite a promising treatment in lupus, and Thomas Derner is going to present some biomarker data from the phase 2, which is showing durable depletion of B cell subsets with 52-week treatment results. And there's also a longer term safety and efficacy readout on ianalumab that goes up to 68 weeks. That's going to be presented by Eduardo Maesler. Um, Lastly, there on those newer trials, Eric Morand, another steering committee member of the Lupus Forum, is going to be discussing some efficacy of the TYK2 inhibitor deucravacitinib. And this time it's broken down according to the different baseline demographics and disease characteristics that were seen in the phase 2 Paisley trial. So I think the momentum is really building in the lupus therapy pipeline there. And what I always like to see is lots of different modes of action that will help to find the right drug for the right patient, and many of those getting closer to licenses now.
I I totally agree. And I think, as you mentioned, that looking at some of our therapies head on and doing those comparisons, that those are studies that really do need to go to get done, because we really need guidance in
Yeah.
trying to find the right drug for the right person.
Yeah, more drugs means more complicated decisions about how and when to use them, but that's a good problem to have.
It's a good problem to have. So we may have other problems and other agents to add on to this menu. And investigation of novel therapeutics goes on. And Rich Fury is going to be presenting results of a limited analysis of the phase 1/2 mission study. And here, they're looking at the immunoproteasome inhibitor, zetomipzomib, in which they demonstrate that there are improvements in lupus and lupus nephritis disease measurements, as well as biomarkers in patients with very highly active lupus. Small study, post hoc, but really important. And further up the pipeline, Kelly Pike, and this is from Pharma, will talk about the discovery of Vent-03. And this is a new mechanism being targeted. It's a novel clinical C-gas. C-gas is, if you recall, is the cyclic GMP-AMP synthase, an inhibitor for the treatment of autoimmune disease, such as lupus. Novel therapies are key to advancing the field of lupus care, and the ACR convergence is full of studies about CAR T-cell therapy. And, this is an area where studies are just exploding. So at this year's ACR, Sarah Sheikh is going to present data on the CABA 201 therapy in patients with immune-mediated necrotizing myopathy and lupus. And Dr. Garantziotis will discuss both the suppression of neutrophil inflammatory profiles following CAR T therapy, and will be also comparing the molecular landscape of CAR T and rituximab-mediated remission in lupus. CAR T therapy and this kind of approach expands into precision targeting of 9G4 B cells. You may recall that this is the B cell compartment that's enriched with autoreactive B cells. And so Jin Liu is going to be reporting the use of CAR and CTAR T cells in lupus. And Maximilian Koenig from the same group will be discussing the use of T cell engaging bispecific antibodies for looking at the same purpose. So, I think that this is a really exciting time. And, there are new therapies that we have for our use, but there are still huge unmet needs. And, as we discover and know more about the mechanisms of lupus, there are new targets that become available. And there are companies that are looking at how to actually try to inhibit or to enhance those targets, depending. And the CAR T studies are just exploding. And, the numbers, I think, are still small, but they're really impressive. They're really interesting. And I think it's really important that people are beginning to look at some of the mechanisms and look at some of the immune effects of administering these medications. And in particularly, I think that, looking at the immune consequences of giving CAR T versus rituximab, which will give you B cell depletion, but not perhaps at the same depth, it's going to be really, really illuminating. So I'm really excited by this.
Yeah, I agree. The first data we heard about CAR T was about deeper B cell depletion, but what these abstracts show is that these cellular therapies have many, many different ways that they can work and more precise targets. And it's going to be a fascinating field over the next few years. And
Yeah,
all of that depends on various different pathogenic models of lupus. And there are some more interesting data about those at this ACR. So one of the most interesting lines of investigation that I've been following has been some of the work on skin disease, like from groups like Michelle Kallenberg's at Michigan, where they're looking at things like the role of the skin itself in the initiation of autoimmunity. So not necessarily circulating immune cells, but actually the cells of the target organs themselves have roles in the disease. So that's continued at this conference because there's an interesting abstract I noticed about which highlights the fact that melanocytes in the skin may actually have some important immune effects. So there's talk on UV-induced keratinocyte crosstalk and type 1 interferon response in CLE patients, where melanocytes are being driven towards an antigen presentation phenotype. And another abstract I noticed that had quite a similar theme looks at the cellular architecture of the placenta. So upregulation of macrophages and interferons in the placentas of patients with SLE, primary Sjögren's disease, antiphospholipid syndrome. So again, new mechanisms that might explain the pregnancy morbidity that we see in these diseases and maybe give us a handle on how to approach them. And I think it's all part of this emerging theme in lupus that says it's not just about B cells attacking healthy tissues. Actually, many, many different cell types play a role in explaining all these complex phenotypes that we see.
Yeah, and I think that that's important because it's giving us potentially targets on non-immune cells and potentially having a different and less side effects without getting the immunosuppression that's associated with so many of our current therapies.
Yeah, exactly.
So, therapies are really important, and measuring disease activity is really important. Um, but I think, it's equally important that although we have all these novel therapeutics and in-depth analyses of disease mechanisms, we can't forget about the patients. And it's really important to remember that what the patients add to the picture and looking at patient-reported outcomes. And to this end, I was really interested in the abstracts that Makisha Jolly has done, looking at analyses of PROs, patient-reported outcomes from the Aurora 1 trial. And she's been wonderful in terms of, advocating for the use of lupus PROs. And so she retrospectively used the Lupus Impact Tracker and the Lupus Pro surveys in patients who were participating in the Aurora 1 lupus nephritis trials. And there was a really interesting abstract from Mark Scherlinger, who looked at the development and the validation of Lupin, which is a patient-centered self-evaluation questionnaire for lupus. And Lupin, I think, is really exciting as it can be administered both by paper as well as electronically on a smartphone. And, this actually offers a way to, detect fluctuation in disease activity from the patient's point of view on a smartphone, and maybe a really sensitive way of trying to ascertain how a patient is doing by as we say, asking them how they are, but they were able to look at how this could correlate with SLEDA and more, I'm going to say, more standard ways that physicians will use to measure disease activity.
Yeah, so as we get more ambitious therapeutically, we start thinking about not just remission, but actually restoring kind of normal quality of life. And those are really difficult endpoints to hit, aren't they? The PROs.
Absolutely. And there are things that our instruments can score, and there are things that we just miss, such as pain and fatigue. And that's been highlighted by some of these abstracts as well.
Yeah,
we measure them well.
And not all of it is disease activity, and that's just really important to understand and find a way to treat the totality of the disease. Yeah. Well, there's so much more we could talk about. I think that's about all we have time for today. I hope you've enjoyed this preview podcast, and thank you for joining me, Cindy. Well, there's plenty more chances to catch up on ACR content with the Lupus Forum. So you can grab one of our highlights brochures, which is at stand 2010. And you can also have a look at lupus-forum.com, and you'll see on there some daily highlights for a condensed overview of the most interesting abstracts to look at each day at the Congress. And after the meeting, we'll all be getting together again to discuss the highlights after having actually attended. Also, if you'd like to be informed about the key abstracts for rheumatoid arthritis, psoriatic arthritis, axial spondyloarthritis, there's also highlight brochures and preview podcasts for those diseases, which are over on the Immune-Mediated Inflammatory Disease Forum. So thanks for joining us today, and I hope you have a fantastic time at ACR.
Likewise.